Hi everyone, it is Dr. Leva, the Queen of Biohacking, and I am here to talk about PEMF. The reason I'm doing this is because I go to conferences all the time. Some people will talk about contraindications, some won't. So I'm here to keep you guys safe. Many of you might not know, but my mom was killed related to medical malpractice. It hurts my heart, and I'm here to prevent this happening, especially at conferences. So if you're new here, I am so glad you found your way. Today we're diving into a really important topic that a lot of you have asked me about. Is PEMF safe for implants, including breast implants or a pacemaker, medical, devices or metal implants? So let's unpack this very clearly, because knowledge is power and your healing deserves clarity. First, what is PEMF? PEMF stands for Pulse Electromagnetic Field Therapy. It is a non-invasive treatment that uses low-level magnet frequencies to stimulate cellular healing, reduce inflammation, and boost circulation. It is used in everything from bone healing to athletic recovery, and yes, even in wellness centers like mine. Big question is, what if you have implants? First, let's talk about pacemakers, because this is a huge contraindication for most electrical stimulating devices. So you can think of insulin pumps, also cochlear implants, neurostimulators. Also, definitely just think about those pacemakers. Electromagnetic pulses can interfere with how those devices function. So in some cases, it could even be deathly. So always consult with your doctor first. I've worked with patients who've had pacemakers, even dual pacemakers, but their cardiologist signed off. Just joking. But let's say you have an implant in your hip, your knee, maybe some dental work. The good news is PEMF is usually safe. Most of these are made from titanium and non-magnetic alloys. So it could be uncomfortable. You just could adjust it to low intensity, but it won't kill you, okay? It won't kill you. What's next? Breast implants. Personally, I would say don't do it, especially if it's silicone. They say that it doesn't interact electronically with PEMF, but the surrounding tissue might be more sensitive. And pulse electromagnetic frequency will move things around. And if you're having maybe a micro tear of something, you don't want to push out the silicone or saline. So if you feel pressure, warmth, or discomfort, I would stop and reassess. So again, it's not a stated contraindication, but I would be cautious. And at the Exercise Center, we say do no harm first. So a good checklist to be safe when you're doing pulse electromagnetic frequency is to use certified devices. So you can ask me. I know some really, really great companies. Never self-treat near someone else who has an electronic device. So your field is important. And your wellness journey is very personal. So your protocol should be too. It's not one size fits all. Some things are safe for all, like grounding beds, which I love. If you can go walk out on the earth, you can lay on a grounding bed. But most devices have contraindications. And if you want to check out some cool protocols, just visit my center at theexercisecenter.com and you'll be okay. So just be smart about things, look up the contraindications, and make sure the provider is not testing things out on you. That's what school's for, okay? So if someone ever says, hey, can I try out this new product? Be cautious.